Yeah, so I mentioned two developments, and they obviously are not all the developments that might change the diagnostic scenario for Alzheimer's disease, but two developments really I pointed out were the blood-based biomarkers and digital biomarkers. And by digital biomarkers, I only discussed remotely administered cognitive testing. So I was not talking about wearables, for example. And that is still a very, well, young field. It's a very nascent body of literature. There are many commercial actors trying to establish themselves on the market right now because obviously the market potential is huge. But there is relatively limited evidence just yet that these tools are actually able to identify early Alzheimer's disease just by testing cognition at home. That being said, I believe in the great potential that these tools offer in terms of providing clinicians with cognitive trajectories rather than just having a one or maybe twice time point testing that you would have in a clinic. And there are obviously a lot of other advantages to testing cognition at home, such as being in a safe, familiar environment. You probably perform a little better than if you have to go to a clinic and you're in front of a white coat. So taken together, the environmental factors and the possibility of frequent testing, so having multiple time points over the course of a certain period is going to be a lot more informative, I believe, than having one testing occasion in the clinic. But that should obviously be complementary, so both should be performed. I believe that this is also going to be the way to screen for subtle cognitive impairment that might be indicated for certain diseases. And then these obviously have to be associated and validated with biomarkers and the clinical assessment eventually. So I was trying to make the case that a future diagnostic scenario for Alzheimer's might involve screening for cognitive impairment at home over longer periods, donating blood samples in Sweden, that would be in the primary care unit. In other places, that might be in the memory clinic. And certain diagnoses might already be made at this stage, while in any case that is unclear, a referral to a more specialized setting would be needed, and there the more established biomarkers would be employed, such as CSF-based biomarkers and PET and MRI imaging. We're really just in the course of launching a study. We're still in the planning phase, but we hope we can launch a study relatively quickly. And this is by no means the only study doing that. There are many efforts doing that, and they are usually implemented in local research and or healthcare settings. But our study is rather Swedish by nature, so we are trying to recruit several thousand individuals in the Western Swedish region that will be asked to download an app to test their cognition, or alternatively test their cognition using a test battery on the internet, so on a website if they prefer a computer. And once they've done this for some time, we invite them to a local primary care unit where they donate a blood sample. These blood samples are then analyzed in Gothenburg by the neurochemistry lab led by Kai Blenno and Henrik Zetterberg. And based on a biomarker profile, we will then stratify a validation cohort who comes into the clinic and undergoes the more established biomarker modalities again and the clinical assessment. So using that design, we hope to demonstrate or at least validate a potential screening scenario and or a primary care scenario where these novel biomarker modalities are implemented, and show if there is diagnostic and or prognostic potential using them in that order. And we're doing that together with the healthcare system. We're so really trying to inform the decision makers about ways to implement these modalities and hopefully demonstrate them the results also in a pretty raw and early form so they can take part of this.